I have POTS? I have POTS. No, not pot. That would be a very different video. No, I have Postural Orthostatic Tachycardia syndrome, or POTS. But what do those words actually mean? Postural, or pertaining to the position of the body, the attitude or carriage of the body as a whole, or the positions of the arms and legs. Orthostatic, relating to or caused by an upright posture. Tachycardia, an abnormally fast heart rate. And syndrome, a group of symptoms that consistently occur together. So postural orthostatic tachycardia syndrome, or POTS for short, is a group of symptoms resulting from an abnormally fast heart rate while the body is in certain positions related to an upright posture. Basically, while sitting or standing for prolonged periods of time, the heart rate gets abnormally high, and as a result, the person gets unwanted symptoms that make them feel, well, rotten. Why does this happen? What causes it? Well, different things can cause POTS: medications, deconditioning, other illnesses, and so much more. But ultimately, it results in the same thing: a problem with the autonomic nervous system. Autonomic? Well, what does that mean? That's the part of your nervous system that works automatically. In other words, the part that you don't have to think about. You don't think about every time you take a breath or every time your heart beats. Your autonomic nervous system takes care of that. Normally, when you change positions or are standing for long periods of time, your body automatically compensates for this change. Your body will constrict blood vessels in order to maintain your blood pressure and heart rate. However, in POTS patients, this mechanism doesn't work properly. In order to keep the blood circulating and getting to your brain, your heart beats faster. Well, a fast heart rate doesn't seem that bad. I mean, most people work out and they're fine, and heart rates get high when you're working out. So what's the big deal? Think about the last time that you worked out. I would imagine you didn't feel great afterwards, especially if it was a very hard workout that got your heart rate quite high. I would imagine that you felt quite sweaty, possibly a bit shaky and weak. And that's how POTS patients feel most of the time from everyday activities, such as standing or getting up from a sitting or laying position. POTS patients often experience a variety of symptoms. The most common are lightheadedness, fainting or blacking out, palpitations, sometimes with chest pain, tiredness and weakness, brain fog, shakiness, sweating, and shortness of breath. But there are so many more symptoms that can go along with POTS. There is also a lot of variability between POTS patients and how POTS manifests. What one person might experience, another person may not. Or it may be worse in one patient than the other. That doesn't necessarily mean their POTS is worse, just different. So how is POTS diagnosed? The history of present illness, or HPI, and symptoms are the best way to identify somebody with POTS. Once the symptoms of POTS are identified by a doctor, there's a very simple test that can be done in the office to determine if POTS is a likelihood. The doctor will have the patient lay down for 10 minutes, and then they will take their blood pressure and heart rate while they're laying down. Then the patient will sit up, and the doctor or nurse will take the blood pressure and heart rate again. Finally, the patient will stand up, and the doctor or nurse will take the blood pressure and heart rate once again. If the patient's heart rate increases by 30 beats per minute or more, then there is a high likelihood that the patient has POTS. The blood pressure is to determine if there's any orthostatic hypotension occurring, which is separate from POTS. It is important to have the patient remain standing for 10 minutes, as POTS may not manifest immediately upon standing, but rather with prolonged standing. Therefore, within those 10 minutes, if the heart rate increases that 30 beats per minute or more, the patient may still have POTS, even if there wasn't an initial increase. There are additional confirmatory tests for POTS and to rule out other autonomic disorders that may be mimicking POTS or may exist with POTS. But this is enough to give the doctor an idea that the patient has POTS. So what can be done to treat POTS? I mean, what good is knowing about a condition unless you know how to treat it? While there is no cure for POTS itself, it can be treated. If POTS is caused by another condition, it's possible to reduce the symptoms of POTS through the treatment of the original condition. If the cause of POTS is unknown, there are several ways to treat the symptoms of POTS. Increased exercise and diet modification can help a lot in POTS patients. More specifically, with diet modification, increase of water and salt intake can help relieve symptoms. Salts being most specifically sodium, potassium, and magnesium. If these first-line defenses do not help, don't worry. There are medications that can be taken. Some decrease the heart rate by acting on the heart itself. Other medications help the body to retain salt better, and yet other ones help the body to increase blood pressure. It is up to your physician to determine which medication is best for you. This can be based on your past and present medical history and your symptoms, as well as other factors such as cost and availability. It is possible to get saline infusions for POTS. Saline infusions should be reserved as a last-line defense due to their increased risk. Now, of course, it's up to your doctor, due to your current and past medical history, or due to the severity of your symptoms, he may want to do this immediately. It is important to listen to your doctor and know that he or she knows best. The doctor needs to take into account all the patient's symptoms, their past medical history, and their other conditions in order to come up with the best treatment for the patient. I hope this was helpful as a very brief introduction to postural orthostatic tachycardia syndrome, or POTS. As I stated, this is very brief. If you would like to learn more about POTS, I will include some resources below. I am also thinking of doing additional videos going into more detail on POTS. Originally, I was going to put it all in one video, but it was going to be very long and honestly very dry. Therefore, hopefully additional videos will follow. The autonomic nervous system and autonomic dysfunction, how POTS is diagnosed, and the treatment of POTS. If you enjoyed this video, please give it a like down below. If there's anything else you would like me to cover, whether it be about POTS or possibly another disease or condition, leave a comment down below and I'll try and incorporate it. Also, don't forget to subscribe. That way you get notifications when I put out new videos. Thank you so much for watching, and I hope you have a great day.